Hello, everybody, and welcome to the Barasch McGarry webinar, 9/11 and the National Cancer Prevention Month webinar. The truth is, 68 cancers have now been linked by NIOSH to the World Trade Center toxins. Many of you out there are our clients, so you know it already. Many of you are new to this, and you're here to learn today, and we are so grateful that we have a really wonderful panel today to discuss not just cancer and cancer prevention, because that's what the American Cancer Society has dubbed February. But we're going to give you a lot of information. This is only going to be an hour. We're recording it so you can watch it later. You can share it. But we're so grateful to you for helping us spread the word because so many people still don't understand the rights to which they are entitled. With us today is first and foremost Dr. Natalie Berger. Dr. Berger is a professor of hematology and medical oncology at the Mount Sinai Health Systems, and she literally works in every Mount Sinai hospital in the New York area. Also with us today is Austin Desavino, who's an associate director at the American Cancer Society. And Austin, welcome back. We're so grateful that you've joined us and that you actually introduced us to Dr. Berger. So thank you for that as well. And I'll be asking you to tell us a little bit about what the American Cancer Society is doing these days. Also with us is Liam Lynch, who's safety and health specialist at the New York Committee for Occupational Safety and Health. And Liam, thank you again for joining us. Also here today are my partners, James Steiner, Lee London, Dana Cohen, and Dom Penson. So we have a lot on our plate. Let's start with a short video just to set the table, and then we'll get right into it.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
It's also critical that we reach our students and our staff members, our teachers who were in the schools 18 years ago.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
Our law firm now represents over 25,000 people in the 9/11 community.
The majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
All right, so we're going to be reinforcing the message that John Stewart said much better than I could, which is access what you are entitled to. The World Trade Center Health Program is a nationwide free program. It's not perfect, but it does try, and they're always trying to make improvements to it. And yet, while over 80% of first responders have enrolled in the program because their unions have done a great job, less than 8% of the non-responders, that's the 300,000 office workers and the 50,000 student and teachers and the 25,000 downtown residents, only 8% of them have enrolled. And it's simply because they don't realize they are entitled to these free programs as well. I'd like to start with Dr. Berger. So Dr. Berger, welcome. As I mentioned in the intro, this is National Cancer Prevention Month. And so I've asked you to say a few words about what's going on in medicine right now in general. I know your specialty is mostly breast cancer, but you're an oncologist. So could you share with us some slides and some information?
Absolutely. Thank you so much for having me and inviting me to join you for this extremely important discussion. Thank you to all of the participants, survivors who have joined us tonight for this important conversation. Today, we're going to talk about cancer screening recommendations. These cancer screenings are so important because we can screen at a time where cancer is in its earliest of stages, or even when things are precancerous, where they are completely curable and treatable, and patients can live and survive this long term. So we're going to go through some of the top cancers and their screening recommendations. Next slide, please. So we're going to review cancer screenings for a few different cancers: for breast cancer, lung cancer, colorectal cancer, cervical cancer, prostate cancer, and skin cancers. Next slide. So why is cancer screening so important? So as we were just saying, screening is checking the body for cancer before symptoms develop. Once symptoms start to develop, that's usually when cancer is at a later stage. And we really want to catch these cancers before we even know that they've started to develop in the body. Especially for all of those who have joined us, we know that 9/11, being exposed to these toxins, the chemicals, the environment that was in the air after 9/11, the risk of cancer is higher. And it can cause all of these different cancers that we're going to talk about today. So it's very, very important to go for these screenings. So if in the future, God forbid, a cancer ever develop, we can catch it early before any symptoms develop. And cancer can be diagnosed at an early stage when it's easiest to treat. And there are so many new treatments available, and when detected early, many cancers can be cured. So the goal here is early detection, treatment, and cure, okay? Survival, long-term survival. Next slide, please. We're first going to talk about breast cancer and some breast cancer statistics. Breast cancer is the leading cause of cancer death in women worldwide. It's important to know that men can also get breast cancer. Screening is not recommended for men, but if any man ever feels a lump in the breast or something that doesn't feel right, it's important to seek medical care immediately. Approximately 400 men die each year from this disease. In the US, breast cancer is the second most common cause of cancer death. And in 2021, there was approximately 280,000 new cases in women, and that accounted for 43,600 deaths in the United States. A person's lifetime risk of developing breast cancer is 12.4%, and it's about 1 in 8 women. And the median age of diagnosis is 62 years old. Next slide. It's important to start talking to your doctor about breast cancer screening at the age of 40 and going for annual mammograms. There are different guidelines for breast cancer screening recommendations by different organizations. Several different organizations have different recommendations. There's the U.S. Preventative Task Force, there's the CDC, there's the American Cancer Society, there's the American Society of Clinical Oncology. All of these different organizations' recommendations are a little bit different, but it's really important to start talking to your doctor about screening at the age of 40 if you do not have a family history. For women with a family history of breast cancer, it's important to start annual mammograms no later than 10 years before the age of earliest onset of breast cancer. For me, as a breast oncologist, I really do recommend starting at the age of 40 because I have so many patients who are diagnosed at the age of 40. A mammogram, people talk about it and some people hear scary things like it's very painful or, it was uncomfortable when I went for my mammogram. But it's a quick test. It's one day out of the year and not even a full day. And this can detect breast cancer at its earlier stage before anything more than surgery is even needed. So it's really, really important to go for this test because early screening saves lives.
Dr. Berger, I'd like to quickly ask you, did you notice a decrease in those annual mammograms as a result of COVID?
Absolutely. Unfortunately, we've definitely seen people who skipped going for their annual mammogram in 2020 or even part of 2021. And we are seeing cancers, coming in at a later stage than they would have had the person gone for their annual screening mammogram, which is, why it is just so important to go annually, not to skip the mammogram, and hospitals are doing such a great job. Everybody's masked. Social distancing is still taken seriously. COVID exposure, unfortunately, we're at a time now where it's really low because the rates are so low. But no matter what, do not miss those screenings. We've been able to do it through the pandemic. We can certainly do it now. So please, if you're late for any of your screenings, speak to your doctor now.
So I know you haven't gotten to the annual full body skin exam and the annual for men, the prostate exam, but did a lot of guys miss those exams as well?
Yes, across the board, all screenings were down.
Yeah, and we're hearing stories just like you just said, with people coming in for screenings this year, and they're already at stage 2 and 3, whereas they could have been at stage 1 or just precancerous.
Yep.
And this is going to be truly heartbreaking. We're going to see an untold count of people getting sick and dying that it wasn't necessary, but for COVID.
Yep, 100%, unfortunately.
Go ahead. I'm sorry to interrupt.
No, please, so important and such important points. Please see your doctor. Please talk about your screenings. Even if we get through this and you're not sure which screenings you're eligible for, talk to your doctor. Your primary care doctor will know. And if you don't have a primary care doctor, it's very important to get one because I know a lot of people don't have a primary care doctor. Okay, next slide. Next, we're going to talk about lung cancer statistics, which of course is very important. It's the leading cause of cancer-related death in the United States. There's approximately 230,000 new cases a year, and 132,000 people died from lung cancer in 2021. It's the leading cause of this is cigarette smoking, but of course, when talking about this, the environmental exposures on 9/11 and the days thereafter and months thereafter clearly contribute to this, to underlying lung diseases, to lung cancer. So this screening is really, really important. Next slide. There have been recent updates and the availability of lung cancer screening has been expanded. The age of screening has been lowered from 55 to 50 years old. So if you're 50 years or older through 80 years old, the amount of pack years that are required to get this screening has decreased. So it used to be that you had to have smoked 30 packs a day, and now it's down to 20 packs a day. And the way to figure out how many packs a day somebody smokes, it's basically the packs of cigarettes per day multiplied by the number of years that you've smoked. So if somebody smoked 2 packs a day for 20 years, that's 20 pack years. Current or former smokers who have quit within the past 15 years are eligible for this screening. And of course, you must be in good health, be able to undergo surgery or chemotherapy if needed, if a lung cancer was picked up. And the way that this screening is performed is using a low-dose CAT scan, and it's done annually. It's a very simple test. It's a quick test. A CAT scan is a kind of donut-shaped machine. It's open on both sides. It's not enclosed like an MRI. So most people who have issues with claustrophobia or anything like that don't have issues with CAT scans. And this screening can pick up a lung cancer at a very early stage. Lung cancer can be very hard to treat, especially at later stages. But when it's picked up at an early stage 1, in some cases, it may not even require chemotherapy. So it's really, really important to go for this screening if eligible. Next slide. Next, we're going to talk about colorectal cancer statistics. This is the fourth most common cause of cancer in the US. There's approximately 150,000 new cases a year and 53,000 deaths related to this cancer. Next slide. So screening has actually been lowered for this cancer as well. The recommendation used to be 50, and I'm sure many of you on this call have heard 50 as the starting age, but it's actually been lowered to 45. And that's really important to know because that's 5 years sooner, okay? And it can continue until the age of 75 is usually the recommendation. Some people who are in very good health, their doctors may continue it into the later 70s or 80s. So it's important to talk to your doctor about that. There are different screening options available. The one that most people have heard of is a colonoscopy, and that's when a camera is used to inspect the colon. But there are other tests available, including stool-based tests, where you provide a stool sample and they're able to check for the stool for any evidence of colon cancer or DNA consistent with cancer. There are also tests where it can detect for blood because there should be no blood in the stool. And if any of the stool tests come back positive, then you would be sent for a colonoscopy. The standard of care, meaning the recommendation, is still to go for a colonoscopy, an actual visual exam of the colon. But if somebody really didn't want to go for that, you said, I'd do it, but I just don't want the camera, then there are other options available. And so then you can still get these stool tests that are done about once a year, depending on which one you get. And then if those come back abnormal, then you would be recommended to go for the colonoscopy. The frequency of this screening depends on many factors. So it depends on your family history. It depends on whether you had polyps before. It depends on other findings that they may find at the time of your colon cancer or rectal cancer screenings. So there's not a specific timeline, but it could be anywhere from every 1 year, which most people do not have to do at all, 3 years, 5 years, or the normal is every 10 years if you have a normal exam. Next slide. The next is cervical cancer statistics. So this is rare compared to the other cancers that we're going to talk about today, but it is the fourth most common cause of female cancers worldwide. It's less common in the United States. There's about 14.5 thousand new cases in the US a year and 4,200 deaths. HPV is the most common cause, and there is a vaccine now available for cervical cancer or for HPV, and HPV is a virus and the most common cause of cervical cancer. So getting vaccinated has been reducing the rates of this cancer, not just in the US, but worldwide. Next slide. So cervical cancer screening should start at the age of 25. Screening is done with pap smears and also where the HPV human papillomavirus testing is sent, and that's done every 5 years. Over the age of 65, if testing has been normal over 10 years, then the screenings can stop. But if there were ever any abnormal screenings or if somebody had a history of cervical cancer in the past, then the screenings may continue beyond that age. And screening should continue even after HPV vaccination because it does not protect against every strain of HPV that's out there. Next slide. Next, we're going to talk about prostate cancer screening. So this one, the guidelines are less clear, but very important. It's important to speak to your doctor about screening and if it's right for you. Most studies have shown that there's a small benefit to reducing death or metastatic disease, which is when cancer spreads outside of the area where it started. And the benefits and risks must be weighed and make sure that it's right for you. Screening is done through a blood test, which is called a PSA. It's a prostate-specific antigen. It's a blood test that your doctor can draw in their office, and it often will also include a rectal exam where your doctor can also feel your prostate. The average risk man should start doing the screening at 50 years old. However, there are risk factors that it should be discussed earlier with your doctor. High-risk men include men who have a family history of prostate cancer, African-American men, men who have a BRCA mutation that's known or in their family. Those screenings should start earlier because in those cases, prostate cancer can develop even earlier. Next slide.
Dr. Berger, I have a question for you that I'm hoping you can shed some light on, because a lot of our clients come to us with nodules or cysts or masses that are either benign or precancerous, and they wonder, as far as the health program is concerned, they're not yet ready for coverage and to file a claim for compensation. But in regards to a diagnosis and screening, how often do these non-cancerous or precancerous nodules actually turn into cancer? And Is there anything you recommend as far as regular screening?
So it's important, to follow up with your doctor for the intervals of screening. PSAs are usually sent, and depending on how quickly they change or how quickly that number rises, that signals a different thing and may kind of dictate how the workup goes. Also, there's certain imaging studies that can be done for these nodules that are found or cysts, to see if they're changing in size or in the way that they look, and that may change how things are done. So it's just really important, just like all of these screenings, not to miss those appointments and those follow-ups, because then you may miss that window where we do start to see an early change in these lesions where they can be identified early. The good news about prostate cancer is it usually does grow slowly. There are always exceptions to this rule with any cancer, even in some of the slower growing cancers. But prostate cancer in a man's lifetime is a very common cancer to develop. And most men who develop prostate cancer, it never will metastasize, which is kind of part of why the screening is a little bit more not standardized as some of the other screenings, because anytime somebody hears the word cancer, it causes a lot of distress. But it's a perfect cancer to talk about how, cancer doesn't mean, this is the end, that, I'm not going to survive or that this is going to kill me, because that is not at all the case. Most cancers, when detected early, when picked up early and treated, are completely curable, and you will be a cancer survivor. Hopefully it never happens, but if it does, you really want to find it when it's early. And that's why these screenings are so, so important.
Thank you.
Thank you. Next slide. Oh, sorry, we didn't do skin cancer. So skin cancer. So there are several risk factors for skin cancer. Of course, sun exposure is very important, light colored skin, aging, having moles, a personal history of skin cancer, radiation exposure, and of course, chemical exposures. Skin self-exams should really be done once a month in a well-lit room in front of a full body length mirror and with a handheld mirror. And what's important to look for is a change in the size, the shape, the color of the moles, and any new moles that develop. If you discover a new mole, go and get it checked out. If you see any changes in the color, the shape of the mole, and you're not sure, it's worth it to just go see the dermatologist and have it checked out. It's important to see the dermatologist at least once a year for full skin checks. As long as everything looks okay, then they should probably tell you to come back the year later to do it again. And it's another one that's really important not to miss, because there can be very subtle changes in moles that you may not pick up, especially if you're not doing those monthly checks or doing it, once every 6 months or once a year, because you may not see that difference. And skin cancers are, when picked up early, very easy to treat. Again, may just require a basic surgical procedure, many of which can be done in your doctor's office, and it's fully curative. So it's very important to see the dermatologist once a year for those checks. Next slide. So there are also other ways to reduce cancer risks. So of course, staying away from all forms of tobacco, maintaining a healthy weight, and staying physically active. Doing exercise at least 3 to 5 times a week with a goal of 30 or more minutes is so important, not just for cancer risk, but for cardiovascular risk, for your overall health. Eating a diet with plenty of fruits and vegetables, staying away from processed foods, fast foods, which all have chemicals in them, which can increase risks of cancer. Trying to avoid alcohol as much as possible, especially never binge drinking. If you do drink, try not to have more than 1 drink a day for women and 2 drinks a day for men. Always protecting your skin, sunblock, hats when going outside and being exposed to the sun. Use an SPF at least of 30 or higher. Know yourself, know your family history, know your risks, talk to your doctor about your risks and about your cancer screenings. And please, please get your regular checkups and cancer screening tests. Don't miss them, don't delay them, it's not worth it. Next slide.
Dr. Berger, thank you. We have a lot of questions, but I'll let my partner Dom, I know he wanted to ask you something.
I 2 quick ones for you, doctor. You mentioned the BRCA mutation. How would somebody know that they had a BRCA mutation?
So this is where family history is really important. Sometimes families don't talk about their cancer history. I have a lot of patients who come in and they have cancer and they're like, why did I get this? And then they'll talk to family members and find out that there were several family members along the line who had a cancer. And when you dive deeper into the cancer history, you may find out that one of the family members was actually tested for something, did genetic testing, and something came back positive. A lot of times people aren't really sure, what it is, or aren't 100% sure of their family history. So it's important.
Sorry. So would you recommend as a form of self-protection doing genetic testing to screen for certain cancers, or no?
Definitely not routinely, genetics is complicated. There's a lot that we don't know. There are mutations that may exist. Knowing your family history first is the most important thing. If you had cancer yourself, your doctor may recommend genetic testing, depending on the type of cancer. Not all cancers routinely do genetic testing. If you don't have a family history, certain do, because we have therapies that may help families who have certain genetic mutations, but routinely doing genetic testing is not helpful. I mean, a lot of people have done this 23andMe or other things where they kind of had those kinds of screenings, but a lot of those assays are not as well validated as the ones that we do when you see your doctor, and some of the labs who have, a lot more experience in doing them. But if somebody did a test like that and something did come back positive, you definitely should talk to your doctor about it to confirm whether you have that or not. If you have a family member who has a mutation that has an increased risk of cancer, definitely let your doctor know, because that may change your screenings and what you go for. And in certain mutations, like a BRCA mutation, if somebody, a first degree relative, has that mutation, your doctor will recommend for you to get tested as well, even if you don't have cancer.
The second question I had for you has to do with the lung cancer information you shared with us. At the beginning of the webinar, we saw a video in which Dr. Wyden talked about how never smokers, it's as if they smoke 2 packs a day for years. And so what I was wondering is, for members of the World Trade Center communities who are non-smokers, always were non-smokers, but had exposure to the World Trade Center toxins, are there screening guidelines for them?
There are not that I know of. I don't know if you know of any, but I don't know of any. It's not a screening test that I routinely order, just because it's not, something that I see day to day. But I think that it's something that's extremely important for, people who had exposure to talk to their doctor about this, But I think a part of, it is also, data, evidence. Every guideline and every recommendations that's made is made on evidence. And unfortunately, it's something that, may not have enough, but I think that there is clearly enough, to say the risks of all of this, are serious. And, from the video and from everything that, anybody who had exposure to 9/11, it's, the lungs are definitely an area that's one of the first exposed. I'm not sure if you know of any guidelines or recommendations for.
Well, we do know it's one of the most common cancers in the 9/11 community. And all cancers in general have been increased. If you were exposed, we're seeing studies showing increases between 9 and 41% compared to the general public. So that's pretty frightening. And that's why early detection, as you said, is critical. Dana, did you have some follow-up questions that you wanted to ask?
Yes.
That came from clients.
Dr. Berger, for cancer patients going through treatment, how has COVID affected that community? Are they more susceptible?
To COVID?
Yes.
So certain cancer treatments do affect the immune system and the body's ability to fight infection. There are certain cancers that affect the immune system, or certain treatments, I should say, that affect the immune system more than others. And of course, especially, in the beginning before vaccines, it was something that, we really worried about, and patients, were at risk of severe COVID more. And still today, certain cancers, certain leukemias, lymphomas, certain cancers where the chemotherapy really affects your body's immune system, your memory cells, where you may not necessarily make those antibodies to the COVID vaccine. Those patients are still at high risk. And now there are medications that, have come out where patients who are at a higher risk of severe complications, hospitalization, or death, they can take these oral pills that can help them fight the infection. So, it's something that we have been handling throughout the pandemic. Fortunately, we are in a much better place today than we were 2 years ago. We have therapies regardless of, what treatments you're getting, what cancer you have, what treatments you're getting. Vaccinations save lives. These medications for patients who can't make an immune response save lives. I can't emphasize, just like screenings, the importance of this vaccination at saving lives. And so, we are in a place today where, regardless of the treatments that you're on, we can help, keep you safe from this virus.
Right. This is a good time for me to mention a wonderful announcement that the special master of the victim compensation made about people who have been dying of COVID. And in many of the cases, these people have died. Our law firm alone has lost over 100 of our clients due to COVID. But in each of those cases, there was an underlying cancer which compromised the patient's immune system, or they had respiratory illnesses, which clearly made them more vulnerable. And the special master has announced that if you had an underlying condition, she will certainly consider that and the patient's death, if they do die, as being caused by their 9/11 exposure. So just because someone's dying of COVID doesn't mean that their underlying 9/11 illness wasn't responsible in a big way. Dana, any other questions that somebody has asked?
Yes, there was another question, and this one is specifically geared towards women who have been through breast cancer treatment. We hear so much about the 5-year mark. What does the data say about women who have been free of breast cancer for 5 years?
So the 5-year mark is an important mark in a lot of different cancers. You know, we usually say that for many cancers, if they're going to come back, it's usually within the first 5 years. And so that's the 5-year mark. And it doesn't just apply to breast cancer, it applies to other cancers as well. But we know that with breast cancer and even with other cancers, there is still a risk that these cancers can come back later down the line. So even though, you know, once you get to 5 years for many cancers, you know, we do say you are a cancer, well, you're a cancer survivor from the start. As soon as you get through, you know, your treatments, we call you a cancer survivor. But there are certain cancers that can, you know, come back even later. So it's important to still follow with your oncologist, you know, with your primary care doctor, still do your screenings, right? Even after breast cancer, even after some of these other cancers, all of them, you should still do your screenings, right? Because there's always a risk that a new cancer or the same cancer can come back in the future. But the 5-year mark is just you know, an important date where usually most cancers, not all, the highest risk is coming back within the first 5 years.
All right, well, this is a perfect segue now to what the American Cancer Society does. I mean, we are so fortunate to be partnering with them on this outreach. Not just to the 9/11 community, but to anyone who's got cancer, any family members, because as Austin is about to tell you, when someone gets cancer, it affects their entire family. It's not just the patient. So Austin, first of all, thank you again for introducing us to Dr. Berger, and tell us what is the American Cancer Society doing during Cancer Prevention Month specifically, but also in general.
Yeah, absolutely. Thank you so much. And Dr. Berger, thank you so much for just sharing all of that information. And just prevention is so important. It is just such an important piece. So I'm so happy to be here today to share about what the American Cancer Society, what we do, who we are, and how we can help you or your loved ones. So our mission is to save lives, celebrate lives, and lead the fight for a world without cancer. So what does that mean? So we are fundraising for all of those different things, and where those funds go and how we are able to help everyone comes out in a lot of different ways. And the first way is via information. So we have our National Cancer Information Center, which is one of the largest gatherings of cancer information that's free to access. So you can call us 24 hours a day. You can visit our website 24 hours a day. The number, it's 1-800-227-2345. Most of our calls come in between midnight and 4 a.m. because
Wow.
People are up at night. They don't know where to go. They're looking at all these things online, and they need someone to call and talk to. And we have real live people 24 hours a day, 365 days a year to talk in over 200 different languages and talk about so many different things. So you can call and get information on specific cancers, treatment options, side effects, coping with cancer, medicines, pain control, clinical trials, prevention, screening, all these different things, live people that are experts. So if you just got back from a treatment and you have, side effects that are going on and you just need someone to talk to, you can call us and we're there to answer the phone. We have resources, so tobacco cessation programs, we have patient services, patient navigation, support groups, medical equipment. We can get you access to free wigs and prostheses and head coverings. Lodging is another big thing. So the office that I work out of on 32nd Street is a Hope Lodge. A Hope Lodge, we have over 25 across the country. They are basically hotels that cancer patients and their families, their caregiver, can stay at for free for as long as they need to. And we have one right here in Midtown Manhattan. And if you're like me, I don't necessarily live right in New York City. I live kind of far away. If I had to go in for treatment every day for 3 months, I'd either be having to pay tolls and gas every single day or a bus ticket, or pay for a hotel in Midtown, which I can't even do, for a weekend now. So you can stay with us for free. We have shuttles to all of the hospitals here. We have a program called Road to Recovery where we provide free transportation for patients to whether it's their chemotherapy appointments, whether it's their screenings. If you need a ride, call us. Access to care is one of the most important things because prevention is important. But if you can't get to the screening, then you're not getting that screening. I talked about hair loss and mastectomy products, reach the recovery so you can find support groups, and then of course research. So our grants fund research all over, and we have over $400 million committed to more than 750 active grants. And we funded over, I believe the number now is in the 40s of Nobel Prize winners in our existence. So the funds that we're raising, we are turning around and making sure that they're going into creating the largest impact in the fight against cancer. And I could probably talk until 6 o'clock, but I know we have a lot of other things to cover, but that's just the surface level of everything that ACS does.
Austin, it is an honor for our law firm to support the American Cancer Society. You are just an amazing tool for an available option for everybody, and I urge everybody to spread the word about what your organization does. We've had so many questions just firing at both you and Dr. Berger. Someone asked, is brain cancer covered? The answer is absolutely yes. It is presumed linked. We're going to get into that in a while. Also, you mentioned something about support groups. Would you just speak for a moment about what that is and the importance of that?
Absolutely. So support groups, whether you're a caregiver, whether you're grieving, whether you're in active treatment, whether you're post-treatment, whether it's a new treatment, we know that you are very rarely alone in your journey, whether it's in person or virtual. So while we may not host every single support group, we have people that work for the National Cancer Information Center, which is our information center, and their sole job is to research services across the country for everyone. So we have people that their full job is finding free support groups, finding free programs. So if you call us, we can help connect you.
And how can they call you? Can you give that phone number again and slowly?
Yes, 1-800-227-2345 or online at cancer.org. So, and I saw some questions coming in about Hope Lodge and support groups. The absolute best way to find all of that is to call 1-800-227-2345. I think it's like 1 or 2, like press 1 for this language, press 2 for this, and you're connected to a live person, and then our live people route you to where the most relevant information is.
Right, and of course they can always call our firm or go online, and we'll put them in touch with you. I can't say enough about the Hope Lodge, but I don't have to, because a number of people who are watching this evening have been at Hope Lodge. Oh, and by the way, Dr. Berger, a number of your patients are online also, and they're saying very nice things about you. I'm sure they would only say nice things, but I could see why. Okay, Liam Lynch is with us this evening. Liam is with NICOSH. Would you tell us a little bit about NICOSH? What is it and what do you do?
Thanks, Michael. It's always a real honor to be here with you guys. So hey, everybody, my name's Liam. I'm with a nonprofit in New York City called NICOSH, the New York Committee for Occupational Safety and Health. We are a nonprofit that's been around for 40 years at this point, made up of labor activists and worker advocates fighting for healthy and safe jobs in New York City. Lately, we've been advocating for stronger worker protections when it comes to COVID. But back, 20 years ago, we were there in the early days of 9/11, and we were advocating for responders and survivors after the attacks to get the healthcare and compensation that they deserved. And so we've been there. My colleagues and predecessors have been there from the early days. And so we are trying to enroll as many responders and survivors who were impacted from that day and in the weeks and months following into the World Trade Center Health Program and to access the compensation that is another program that was established by this Droga Act of 2011. But to go back, we really try to do outreach on the World Trade Center Health Program. There was hundreds of thousands of people affected that day and in the months following. And this healthcare program is set up for them to receive healthcare for their World Trade Center 9/11 related conditions. And there's over 100 different illnesses that have been connected to exposure to all of those World Trade Center contaminants. And the health program is national. So it's not just located in New York City, but there's a national network so that doctors are in every state as we speak, and there's responders and survivors receiving care in every state. There's a recognition that we all, there's a lot of retirees from New York City that went down to Florida, and so this program is countrywide. And it's made up of doctors who specialize in treating 9/11 related conditions, who understand the unique circumstances of those conditions and of the experience of caring for this really unique population. And we're not just providing care, but there's also a ton of research going into how do we better care for responders and survivors of future disasters. But how do we care better for this population in years to come? So this program is offering, medical tests, doctor visits, surgeries, prescription drugs. There's a pretty robust benefit counseling program, and this is at no cost to the responders and survivors.
Liam, quick question.
Yeah, absolutely.
We get questions from clients about, them being asymptomatic, and they're part of the health program. They have the exposure to qualify for the health program. But can you just talk about the cancer screenings that someone can get from the health program? Just because a lot of people are nervous about it.
Yeah, absolutely. This is why we're here today. So the World Trade Center Health Program provides screenings and treatment for health conditions. And the screenings can include breast cancer, colon cancer, cervical cancer, and lung cancer. And the doctor, your doctor in the program will recommend the best screening based on your individual circumstances. So for members in the program who are patients who are at higher risk for all of the reasons that we've discussed here today, your doctor in the program may recommend that you get a cervical, breast, colon, or lung cancer screening. So their screenings are provided at no cost to members and patients of this program, but it depends on your individual circumstance and whether you're at high risk and fall into category that would meet the eligibility for screenings.
And Liam, you can still use your private doctor. A lot of people are under the misconception that you have to give up your private doctor to join the health program. And I always explain to my clients that no, it's just an added layer of benefits. And this is something that you want to be with people in the 9/11 community suffering from the same type of conditions that you're going through now, but you can keep your private doctor, and we encourage people to.
Absolutely. I get that question a lot too. This is just added to the healthcare, that you're already receiving. So if you love your primary care doctor, your specialist, we are not asking you to give that up if you are in the World Trade Center Health Program. This is just an added benefit to your life. Not subtracting.
And treatment for prostate cancer is most definitely part of what the health program does.
Yes, I did not mention prostate. I was listing them off, and prostate is definitely absolutely one of them.
And because, and we're going to get to a slide about this in a minute, but after skin cancer, the most common cancer in the 9/11 community is prostate cancer.
That's right.
Mostly because so many of the responders were men. But it's an incredible explosion of prostate cancer. As you heard in the initial video, I am a prostate cancer survivor. And it's not a death sentence. I did want to ask a question about the National Health Program, Liam. Many people who may be watching this evening are living all over outside the New York area. And a company called Logistics Health Incorporated was providing the treatment outside of this New York area. Well, LHI, as they are also known, has recently lost their contract with NIOSH. So can you tell us who is taking their place, and have the ground rules been set up yet?
Yeah, and I'm blanking on their name right now as I
It's called
bring this up.
Sedgwick. It's called
Sedgwick, yes,
Health.
Sedgwick. Thank you, Sedgwick. There is a transition period that's happening right now. So LHI lost their contract, and Sedgwick is taking over, and so 2022 is going to be a year of transitioning their healthcare and benefits over to that other program. So right now, it's if you guys are in the national health program, you should be monitoring your emails from NIOSH. But right now, there's nothing that the patients need to do. This is happening this spring. There's information online. We can drop that in the chat box. We definitely should, give that information to anyone because there is a FAQ page on the World Trade Center Health Program website about this transition. But right now, if you're in the national program, there is nothing asked of you to do.
I got to tell you, I am very nervous about the transition. So many people complained to our law firm about the treatment they were getting from LHI, phone calls not being returned, impossible to get an appointment, so long a wait to get an appointment and then to get your illness certified. So it's really heartbreaking, and I just hope that this new company does a better job.
Me and you both, Michael. Me and you both. Absolutely.
All right, let's move on. Matt, can we go to the next slide, please? And by the way, those of you who have asked questions that we haven't specifically addressed, I assure you that even after this, we will get back to you. We'll be sharing questions with Dr. Berger and with Liam Lynch, and we will get back to you with other answers. But I just see here, is lymphoma related? Absolutely. Lymphoma, leukemia, multiple myeloma, all the blood cancers are related. There's a presumption. You're going to hear that word a lot coming up. Lee, would you take us through some common victim compensation fund personal injury awards?
Sure. And thank you everyone for joining us. It's really important that everyone get the right information on moving forward on a victim compensation fund claim. So like stated earlier, when the Zadroga Act was created, we have the World Trade Center Health Program on one side, which is free medical care for the rest of your life. And on the other side is the Victim Compensation Fund, which has been extended to outlive us all until 2090, because the government sees how many of these cancers are developing now. And just to be clear, because I saw someone ask a question, just because you got diagnosed with cancer and now you're cancer free, you still can make a claim. Just because you're cancer free, it doesn't mean that your pain and suffering stopped. It doesn't mean that, God forbid, it could come back or something could happen. So don't be discouraged. I mean, it's an amazing thing that you're cancer free, but you're still going to be moving forward on a claim because this is due to your 9/11 exposure. But there are many claims to be made. And when you analyze a claim with the Victim Compensation Fund, you're going to be moving forward on a claim for pain and suffering. It's called a non-economic loss claim. And these claims have range. Now that the fund is permanently funded and extended, an award can range for non-cancer, non-life-threatening illnesses from 20 to 90,000, also 10. But the best part about the Victim Compensation Fund is that you never waive your future legal right. I've been working on this now on the VCF for over 9 years. So I've dealt with clients in 2014 that had asthma. They got an award, and then 5 years later, they got diagnosed with prostate cancer or breast cancer, and you can amend your claim for an increased award. You never waive your future legal right. So many of my clients that have gotten diagnosed with a severe cancer, will wait 3 years to tell me, and then I'll amend their claim. So I encourage everybody listening now, if you have any change in your diagnosis status, any change in your disability status, please let us know. I mentioned disability status because you can make a claim for non-economic loss with the Victim Compensation Fund, and you can see non-cancerous awards can range from 20 to 90. The life-threatening cancers can range from 200 to 340,000. But you can also make an economic loss award. It's a claim for loss of earnings because many times, these cancers, these respiratory conditions will force you out of employment, either short-term, long-term, but it's still something that is covered by the Victim Compensation Fund and something that we need to know about, your disability status as well. So please just keep us informed and please ask us questions because that's the only way you'll get to the truth of, the information that you hear. Also, if you're not part of the World Trade Center Health Program yet, out-of-pocket medical expenses are key. It is so expensive to treat cancers with all the different treatments, chemos, medications, that if you're not part of the World Trade Center Health Program and you're waiting to get in or you're waiting to get your condition certified, none of your treatment is currently being covered by the health program. So save every receipt that you have. Dom and Dana, who run our family assistance team, will talk about the benefits of a claim, God forbid someone passes away. But the biggest thing is I just want everybody to keep us updated on your status and to always remember that you can always amend your claim based on future circumstances. If your asthma gets worse, if your GERD gets worse, this is why we're here and this is why the fund was extended.
Yeah, thank you, Lee. That's all critical information. Let's go on to the next slide. We still have a lot to cover. Dom and Dana, go ahead. You take it from here.
I saw a question was just asked about whether there would be, and you see the answer here on your screen, whether there would be, even if somebody collected a personal injury award, if they then passed from World Trade Center illness, would their estate be able to recover an additional $250,000 for the victim's pain and suffering? And as this slide tells you, the answer to that is yes. The estate would be entitled to a further award of $250,000 if the person died of their World Trade Center illness. And in answer to that question, and you see this again on the slide, a spouse, a registered domestic partner, any dependents, whether children or non-children, but dependents, financial dependents of the victim, would also be entitled to a direct award of $100,000. This is in addition to the personal injury award that the person collected if they collected an award while they were alive. If the person was eligible for a personal injury award and never collected it, their estate, which is to say their family, would be able to collect the personal injury award that they never collected. And then also all of these amounts that you see before you on this slide for the wrongful death part of their award. They would also be entitled to some other categories of damages, such as the reimbursement of all funeral expenses and compensation for something called replacement services. Dana, what could somebody do to help their family in the event that, heaven forbid, they ever pass from a World Trade Center illness? What could they do now to help their family to file a claim like this?
There is a lot that we in the 9/11 community can do to help our families. The first thing is we want to arm our families with information. So often the families that come to us quickly, which is important because it's not always a very fast process, it can take some time. The families that come to us quickly will tell us, he told me to continue with this. He told me to call you. She told me that we would be entitled to benefits from the fund. So important because all of us who live with cancer, or who have seen someone fight cancer know the toll that it can take on the individual fighting cancer, but also on the family, financially, emotionally. And so we have to arm our families by telling them that, yes, they are entitled to this. And, if we pass away from cancer, there are benefits there and they have to know about them. Getting into the program is the most important thing that we can do for our family. Because if we are found to be eligible, if we qualify, then our family will not have to go through the process of finding witnesses, of having the VCF say that the condition is eligible. We can do that for our families now, and it's very important that we do. So the two most important things, if I leave you with nothing else, it is get in the program and it is talk to your family.
What about, I don't know if you've mentioned this, doing a will? Why is that so important now?
Getting a will is important because some part of the victim compensation fund is going to pass through your estate. And if you don't have a will, then that part of the award is going to be distributed according to what are called the laws of intestacy. That's not your choice. That's what the legislature says should happen to your property, and it might not be right for your family. The other thing is, the person who will be entitled to bring the wrongful death claim is going to be the executor or administrator of your estate. If you have a will, you'll name the person, and that person will be armed with the knowledge because you will have told them. They will be armed with the power because they're your executor, so they can bring the claim, and it will smooth the process substantially for the family if there's a will. If there isn't a will, it doesn't mean it can't happen. It just might not happen exactly the way you think.
Okay, and again, I can't emphasize enough, and maybe Danny, you can speak to this. When they say there is a presumption linking 68 cancers and I think Liam used the word, the number 25, 30 respiratory conditions. What do you mean? What does the government mean by there's a presumption?
A presumption means that you only need to show that you were exposed. You were there on 9/11 or sometime during the 8 months that followed, and you developed one of the covered conditions. You don't need to show what caused it. That question is not going to get asked. It doesn't matter if you had a family history. It doesn't matter if you smoked. It doesn't matter if you're obese. It doesn't matter if you didn't do all the things Dr. Berger told us to do, like eat the green vegetables and, the presumption means that if you were there and you develop one of these conditions, you are covered.
Okay, and Lee, what do you think people should do as far as getting witness statements now, even if they're healthy?
Yes, 100%. Get them now. We find too many situations where the affiant of one of our clients is suffering through a terminal condition and can't even testify at the hearing. And if we got these affidavits beforehand and we were able to review them in much better detail, even though while our client was healthy at the time, it would have been so much better because we don't want you acting when you're sick. We want you acting now while you can get together, remember who you were with. We will help you in that situation, but we're finding way too many times where other affiants of people are so sick and they can't even complete the paperwork, or they're like, great news, I found 2 of coworkers, but both of them passed away already. And that's the problem with so many years going on, that companies close down, but it's not impossible, and we're here to help. We have a database full of information. We've been doing this for so long that we track and can tell certain, situations where presence documents will hold a lot more weight than in other situations. So
That's true. Thank you, Lee. That's a great point. We can, in many cases, help people find witnesses, which is what the government wants. Look, they're paying tens of thousands of dollars for chemotherapy treatment. They want to make sure, the health program wants to make sure that you were really below Canal Street or below Houston Street, wherever it was. They're going to pay you money for compensation for your injuries, for your lost income. They want to make sure you were there. So please secure that evidence now. You don't need to come to us. Congress has limited every lawyer's fee to 10%. I mean, we think we're special because we take it so personally. Our secretary, Liana, died at age 47. Our office is just two blocks from ground zero. She died of breast cancer. Another paralegal, Dennis, he died of kidney cancer, also at age 47. We have so many people here who work here who are the children of responders. And that's why they get it when people say, oh, you don't know what I'm going through. We can tell you, yes, we do know what you're going through. But again, you don't even need to have a lawyer, but don't miss this opportunity for free healthcare and compensation. It's so critical. And, James, I wanted to follow up with one question for you. The biggest, answer we get from people who don't register is, oh, I thought this was for responders only.
Yeah, and that's one of the common misconceptions is, and there's so much misinformation out there, but the truth is that yes, the majority of the claimants who filed early were first responders, but that's not everybody who's covered. You have the whole survivor community, and that is everyone in Manhattan below Canal Street who was an office worker, a resident, a student, a teacher. So long as they were there on 9/11 or the 8 months that followed, they will qualify for this free healthcare and compensation. And Canal Street is the cutoff for compensation, but for for health program coverage, you actually only have to be below Houston Street. So if you think you were in the zone, you should give us a call and we'll tell you what benefits you may qualify for, and we can help you get started. And like Michael and Lee were saying, we can help you secure your evidence so that you can actually enroll into these programs and avail yourself to the benefits available.
All right, thank you. And I'm going to, Dr. Berger, I'm going to give you the last word here. This is National Cancer Prevention Month. So says the American Cancer Society. What is the final message that you want to give everybody?
Talk to your doctor, get screened for cancer, and hopefully you never have to hear the word cancer, but just go for those screenings because it's better to find it early than to find it late.
Thank you all. I appreciate your attending today. For those of you who have asked, we literally have probably over 100 questions that we didn't even get to. I assure you that we will reach out to every one of you. Tomorrow, we're going to send out a summary of this recording. So a lot of you asked, is this being recorded? Yes, it is. We will send you all a 30 to 35-minute version of this webinar, which you hopefully can share with your friends, your colleagues, your former workers, your former fellow students. Again, all we want you to do is access what you are entitled to. Please be safe out there. And it is an honor for us to represent the 9/11 community. Thank you for watching tonight. Good night, everyone.